Molnica's prevention journey started in 2007 with the launch of Mepilex Border Sacrum, a dedicated shape dressing for protecting the sacrum area. New versions of the Mepilex Border Sacrum and Heel dressings were introduced in 2017, improving ease of use and coverage of at-risk anatomic areas. Molnica has worked with clinical, scientific, and health economic experts to understand the etiology of pressure injuries, the extrinsic factors that cause them, and the clinical, personal, and financial burden that these wounds inflict. We are committed to improving clinical and financial outcomes and improving the lives of patients around the world by designing and developing products and services that can significantly reduce the occurrence of pressure injuries. Research has shown that Mepilex border dressings have two modes of action that provide one-of-a-kind prevention capabilities. Our unique dressing layers combine to absorb and redistribute forces. And another special feature is how the dressing manages directional forces. The material properties in the 5-layer construction that are found in Mepilex Border Sacrum, Mepilex Border Heel, and Mepilex Border Flex means that the layers interact with each other to absorb and redistribute pressure, shear, and friction, and avoid transference to the skin and soft tissues below. Research has identified that different anatomical locations are subjected to different directional forces. The sacrum and heel are the highest risk locations for pressure injuries. In these anatomical locations, the forces that are experienced are one-directional forces, occurring in the sliding direction. This happens when the patient slides down the bed. Recent computer modeling has shown a significant reduction in high stresses when using Mepilex Border Sacrum. In order to provide optimal protection for these anatomical locations, Mepilex Border Sacrum and Border Heel have been designed with deep defense technology, which provides extra strength in a sliding direction, as well as optimized anatomical shapes. In other anatomical locations, the forces are multidirectional. An example of a high-risk area that encounters multidirectional forces is the iliac crest during prone spinal surgery. During this procedure, the patient incurs pressure from above due to the weight of the patient bearing down, shear and friction in multiple directions due to the angle of the support surface, and movement and vibration during surgery. Recent computer modeling has shown that the Mepilex Border Flex dressings can reduce high stresses by 70 to 80% in soft tissues over the iliac crest when exposed to multidirectional forces. Mepilex Border Flex with Flex technology is designed to stay on and uniquely conform, providing protection against multidirectional forces. In summary, Mepilex Border Sacrum, Mepilex Border Heel, and Mepilex Border Flex all absorb and redistribute extrinsic forces to help protect against pressure injuries. Mepilex Border Sacrum and Heel with deep defense technology are optimized to protect against the one-directional forces experienced in the sacrum and heel when a patient slides down in bed. Mepilex Border Flex with Flex technology protects against the multidirectional forces experienced in other anatomical locations. So, for every anatomic location, Molnica has the right solution to protect your patients.